This is the Emergency Medical Minute.
All right, so for my medical minute today, I want to talk about a patient I took care of. This wasn't really related to why he was here, but it was interesting because he was a paraplegic, and he had his paraplegia from something called Cauda Equina syndrome. And unfortunately, in him, it had been delayed by several days, and he had resultant paraplegia, some bladder dysfunction, sexual dysfunction from it, which is not too uncommon. So Cauda Equina syndrome is really the compression of the nerve roots that end after the termination of the spinal cord. So that's around T12, L1. Cauda equina is Latin for horse's tail, so it's just kind of a bundle of nerves that go down, and anything that occupies that space or can fill that space could cause Cauda equina syndrome. So whether it be trauma, a disc rupture, infection, blood, they all potentially cause it, but most of the time we're going to see it from like a disc rupture. And so what can make it difficult to diagnose, and probably what led to his delayed diagnosis, is the symptoms can be subtle. We're typically taught it's like saddle anesthesia or numbness in the perineum, so kind of like if you're sitting on a saddle, but that might not be only identified if you're like doing pinprick testing. The patient might not report it. Sometimes they might have bilateral symptoms of pain, numbness, weakness. They might complain that they're having some incontinence or bowel difficulties, but how many of our back pain patients are on chronic opiates with constipation? So it can be tough to tease out. There's not really one symptom or a constellation that's highly predictive or one that carries a large negative predictive value either. You can use like ultrasound or a bladder scan potentially to look for like a post-void residual. So certainly if someone has less than like 50 or 100 cc's in their bladder after a void, that might be a little bit more predictive against it, but nothing's 100%. And really just kind of use all that to risk stratify whether a patient needs imaging, and that's how you diagnose this. So preferred imaging is MRI. If you don't have MRI immediately available, or for whatever reason they can't go to MRI, a CT myelogram can be done as well. But that's a diagnostic testing of choice. It requires pretty urgent or emergent decompression by a neurosurgery if it's identified to help prevent those long-term effects. So that's Cauda equina in a nutshell.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.